And your head weighs about how much? Yeah, anywhere from 10 to 15 pounds, depending on if you're a charger player or painting, or your hair. Okay, so most people, because of gravity and posture and sitting or whatever, head tends to go forward, right? You can see some strain here. So what I usually do is that I put like a weight here. It's about a weight of 10 pounds to show them how much strain that's putting on those muscles. Okay. Then if I'm up here, and I'm holding that weight, much less strain. So it just kind of helps them visualize so that when they go to do their chin tucks or whatever exercise I'm going to have them do at home, that they can work on that. So there's a release that you can do. Most people have suboccipital tightness will get the headaches that start here and they kind of come around to the front here. So if you have a patient who says, I have a headache, a lot of times it's just one side, but it'll come to that frontal area. What do we call that? Referred pain, right? So it's a trigger point back there, right? If I touch that and it goes to their eye, yeah. And sometimes they get it on both sides, all right? Just depends. So I'm going to have him lie down. He's getting his log roll and all this good stuff. Past him all his contraindications. And I generally usually use this because it flattens their back and relaxes them a little better, but some patients not so much. Is that comfortable? It's nice. Okay. And then I'm going to use a stool. Because I want to use my body mechanics, and I want to be relaxed. But there's two ways I could do this standing. But I'm a lazy therapist, and my arms have gotten weak. I'm really not a lazy therapist. I don't know why I say that. I'm far from it. And he can hold this and kind of helps him relax. We might do a little bit of diaphragmatic breathing to start out with. I might have asked him to just do some breathing for me, in and out. Think about having it come from your belly. And each time you breathe out, Chris, I want you just to make your head heavier. Okay? I'm going to use this kind of a grip. It's called a lumbrical grip. Okay? On those suboccipital muscles. You can feel the the bone. Okay? Like if you're sitting here talking to the whole world, you're never going to find what's going on in there with them. So just kind of relax with them. This is kind of one of those om kind of things. I did ohms last night and I should have. Oh, if my husband saw me now. It was pretty fun. So now, I'm going to just do a little bit of distraction. So I'm coming like this. Is that okay? And that's a suboccipital release. So you just hold it there to feel something release. Or you get tired, or you run out and have another patient and work on it again. You can also massage these guys, okay? There's nothing wrong with going in here. Massaging, okay? Making the muscle, just building. Okay? So that's a suboccipital release. Not sure if you guys are allowed to do spinal moves yet. You can do joint moves. Sure. So there's another nice little cervical bone that you can do to help with this. Because a lot of times what happens is you have your, what we call your OA, your occiput and your axilla, the top joint of your cervical spine is a lot of times tight and it needs to be normalized in order for those suboccipital muscles to have to move so hard. So then after I do this release, what might I do to educate these muscles that I've just released? So then I might try some chin tucks with them. And we call this a yes-no. Okay? So this is the yes. Versus yes, you're a great professor. This is awesome class.
Still have your hands up here.
I am. I'm supporting it here. Because if I were to have them to do this at home, I don't know if we have them here. I have some at home. I'll bring next time. But it's called a Gertie ball, where you can just use like a beach ball when they do these at home. And this exercise helps relax. So I remember how to use a beach ball. And this is a cheap way to do it. The Gertie balls are only $5 though, so most of my patients will buy one.
Gertie ball?
Gertie. They're actually kids' balls. I'll bring some. I have like 3 or 4 at home. I'll bring some and I'll choose on Thursday. I'll donate it to the class.
We'll get some.
Are you getting this on film, Dejan?
No.
High for him. My goal is I don't want him to be in flexion. I want him to be neutral. And that ball is just going to support him while he does his yeses. So that would be my home program for that patient who has tight suboccipital muscles. I've done the release, but I now want to educate those muscles so that they're strong enough to keep them back here versus out here. Okay? So just getting those muscles. Not for this. For those would be when I'm doing for just other cervical issues. So you're right. So that's for something different. And you would use that same curvy ball, keep them in neutral. Okay. The other thing that you could do if you don't have strong arms, that will kind of, it won't release it quite as well, but it will work fairly well, is if you have a belt. Do you have seatbelts for you guys? And I'm just leaning back, okay? And that's going to relax us. How's that feel?
Good.
Now, compared to when I was doing the suboccipital release, what was the difference?
Feels less
Specific.
less
right?
specific. Yeah.
That's much. But it will help relax us. So I could do that, but I have to use my body, and I have to have strong upper arms. And he's got a 10, 15-pound head. So there are things, seat belts. This doesn't work quite as well because it's probably big enough for my two scale. But we'll try it. My butt. Yeah, see, so this needs to be longer. Okay, so we should. So I have, there's a course I went to called Brian Mulligan, and he just sold us, they basically were seat belts for cars, but they make great rolling belts. They're great for people who are smaller to protect your joints in your body. You're doing certain techniques, like if you're moving the hip or you're doing something on the hip. So I keep this up really high towards me. My hands are like this, okay? I have this in here to support me. This comes up to wherever I feel comfortable at. I make sure that his ears are just flat, so I'm not doing this on him. So it's okay. And he's not going to hear once I do this, so I'm just going to tell him what I'm going to do. I'm just going to pull on him a little bit, okay? And let me know if that bothers you. So then I just lean my body. So Curtis, how does that feel compared to the towel?
It's stronger.
Yeah.
For sure.
I have, for me, because my arms are not that strong anymore, this is better. And if you're someone who wants to just protect your body, this is awesome, okay? And then with this, I can kind of do that suboccipital release, and then I can switch over and do a little bit of traction. And then I can also massage, okay? So I have good body mechanics. I'm not feeling anything. It's all coming from this belt. So you just want to make sure this isn't too long, that you have it in the right spot for you. And actually, this worked pretty good. Never used to get big belt before, that works okay.
What are things to be cautious about when we're doing traction, distraction?
Yes, so you guys would not do this unless it was a plan of care from your doctor as far as the traction. The suboccipital muscles, the release, totally fine to do. The one thing that we do when we're going to do any kind of traction or anything like that is called a carotid artery test. That we make sure that that patient doesn't have any occlusions. So your therapist would have cleared all that, okay? So, but that's a good question. So you're not going to do these things unless it's in the plan of care from your physical therapist, okay? But totally fine to do. This, you're just releasing muscles. As long as you're keeping them neutral, there's nothing that you need to worry about as far as the suboccipital release. Traction's a little bit different, okay? If somebody had a cervical fracture or something like that, you're absolutely not going to do that. So when you guys practice this on yourselves, just make sure nobody has any of that kind of stuff, okay? And you would not do this in the clinic unless your therapist has told you it was okay, and they've cleared you and that you are, skilled to do that. Okay? questions on any other soft tissues that you guys need me to show you that I didn't include? Was on your list. You guys all feel pretty comfortable with everything? And then if there's one that comes around that you guys have as the semester goes on, just, holler at me. Okay? Let's read groups. So let's do this. Get into groups of 2. Okay? Is there an even group of you? Then you can try a different position. Okay? But try one position in the low back, one position in the other.